Newsfirst Newsline with Faraz Shaukatali.
And a very good evening to you and a warm welcome to Newsline Live. Now, of course, Sri Lanka is always politically dominated, but apart from politics, we thought we'd take up a subject which is very close to the hearts of most Sri Lankans these days, and that, of course, is the pandemic, COVID-19. To discuss various public health issues surrounding the pandemic, we've got here the Director of the Health Promotion Bureau, Dr. Ranjith Batuwanthudawa, who's right here with me. Very good evening to you, Doctor.
Very good evening.
And Doctor, Sri Lanka, of course, is doing pretty well when it comes to the vaccination program. Vaccinations have been secured. The acquisition process seems to have been now successful, and the rollout is very good. What do you have to say about that?
I think Sri Lanka, we were one of the first countries to receive the vaccines from the COVAX facility of the WHO. In addition to that, the government was good enough and fast enough to purchase also the vaccines. So right at the moment, if you look at the numbers, if we go by the total population, we have passed 10% vaccination by both doses in the country, and we have passed 40% of the population if at least one dose is considered. I believe this is one of the best figures around the world, in our part of the world. And we saw that Sri Lanka was in international news also recently, doing one of the fastest vaccination programs in the world when it comes to COVID-19 vaccinations. Of course, Sri Lanka is known to have one of the best childhood vaccination programs.
That was going to be my other question.
Oh, yeah.
Is this because our sort of vaccination program is in place, has been in place for several years now? Is that why we are finding it quite easy to get the vaccination done?
That's one of the reasons, and the knowledge and the understanding and the attitude of our people. They are quite aware of the vaccines and the value of the vaccines. So I believe we were in a better position to float the vaccination program, and the reception was really good.
I see. And why do you feel it's necessary to have these interprovincial sort of travel restrictions, for example?
Now, when we first got this COVID-19, of course it was in 2019, latter part when the world got it, and we in Sri Lanka got the sense and the feel of it. It was around 2020 March like. So over the last 1 year, 1.5 years, this is a new disease and this is a new virus to us. So we are understanding and we are learning about it. We are learning from our experience, and we are learning from the experience from other countries. And to make the matters a little bit difficult for us, and we are seeing new variants of the vaccine which is causing the disease. In comparison to if we look at some other vaccine preventable diseases and the viruses, like let's say measles, that's a very stable virus. The vaccine has been there for a long time, and we know almost all about the vaccine and the virus. But in this case, we have to keep on learning how best to tackle. So I believe with the wake of this new variants, especially Delta variant story coming, and we know it's there in our community, maintaining some level of restrictions, interprovincial. In addition to that, if we know the areas of this Delta variant circulating, and we know it's happening in the Colombo Municipality Council area, so restricting going to those areas and imposing certain level of self-restraint, this is very important, rather than the restrictions and the restraint imposed by the government or the Ministry of Health. Each and every individual of our country should try to impose some self-restraint about this travel and going here and there and attending to non-essential work.
I see. Doctor, I have this question, but it's a story. I know a young lady who's designated a frontline worker working in a lab. This is not here, it happened elsewhere, but it's relevant.
Same story.
And so was fully vaccinated with the AstraZeneca, both doses, 14 days long gone by. 3 months later, she tested positive, and 2 days thereafter, the NHS people called her and said, well, look, you've actually got the D variant, the Delta. But this young lady told me that she felt nothing more than a heavy cold, although she had a cough, and the cough sort of continued a little bit thereafter, for maybe a month or two thereafter. How come? 2 vaccinations and then you get positive?
Yeah, it is possible. This is, I told you earlier, now this is a new vaccine, new virus, and we are learning from it. And there are a lot of things unknown.
Yeah.
But among these, a lot of unknown things, there are certain things which we know very clearly. So one is about the vaccines, what it prevents. We know very clearly all the available vaccines, they prevent death from COVID-19 infection, and they prevent severe disease. What is severe disease is that you have to be in ICU so many days, you have to be with oxygen, and you have to be breathed from a machine, something like that. So COVID vaccinations, they prevent the death from COVID-19 and the severe forms of the severe complications of the disease. So that is certain, we know very well that. But it could, you could get the infection, you could get the virus into your body even though you are vaccinated and protected. So this it's 14 days past the second dose, still you could get the virus, still you could carry it, you could have a minor version of the disease, and the worst of all, you could be spreading it to the others.
Right.
You could be a silent or asymptomatic. Yes.
But what?
But that is why we want people who have got the vaccines to continue to adhere to preventive measures, wearing the mask, keeping 1 meter distance always, and keeping their hands clean.
Doctor, when somebody is on, as you said, on ventilator and so on, then the situation is rather serious. What chances of recovery?
Now, if we check a normal person with the normal respiratory system, and one of the indicators nowadays being discussed is the oxygen saturation, and some people, they have their own pulse oximeter at home as well. So if you check your pulse oximeter, that is how much of oxygenation in your blood, it's given as a percentage. So 100% is the max, so anything above 95.
And you can use that with a little device from home.
So 98, 99, 100% is a resting, healthy adult male.
When do you start getting bothered about it?
So if it is anything less than 95, that's something wrong.
It's only small margin.
Yeah, but that's how normal it is. I mean, you are exerting, you are exercising, but still you will be within 95% because your lungs are working well. So that's one of the indicators to see if it is wrong. Now, going back to the question you asked, so the people who are put into the ventilation and oxygen supplementation is anybody who is going down 92, 93%, yes, depending on other features also it will be decided.
Yeah.
So anybody who was on the ventilator definitely has to be less than 90% of oxygenation.
Okay.
And we know there are certain people who recovered after going down to 70% even. So we cannot give exact level what is a bad sign, but it's a collection of symptoms and signs of the clinical condition.
People are complaining. Well, one of them is making a statement saying that 300 policemen have been who have been vaccinated have now contracted the virus. I don't know that's obviously this is a message. We're not sure what it is. That's one. But that
it could happen.
It could happen. You explained that. The other sort of worrying feature amongst the public, of course, is the apparent non-availability of the AstraZeneca second dose. it's somebody here saying it's been 3 months since we had our first dose of AstraZeneca. When can we look forward for the second dose of the same thing?
Okay.
Somebody else is saying 19th of July was supposed to be the date, and today is sort of going past that.
So if I can give a little bit of background to this story. So we were the first one of the first countries to receive the vaccines from COVAX facility of WHO, and that's how we got this Covishield vaccine, that's AstraZeneca from India. And at that time we had the understanding and the plan, the government was going to purchase the balance vaccines from India. But during over that particular period, India got a very severe third wave of the infection, and it was sort of going out of control. Like they had a lot of cases, lot of deaths, so the government stopped exporting their vaccines produced in the country. So we were in a hotspot where we didn't have the vaccines for the second dose. However, the good news is within next 1 week or 2 weeks, we are receiving 1.5 million AstraZeneca doses. And
wow, that would be excellent news.
Yes, that's very good news. And the other good news is when I told you this is a new thing, we are learning lessons by the research done in other countries. So one of the things they found was ongoing. They were checking on the progress of the people who got only the first dose of AstraZeneca, and they realized that even up to 47, 48 weeks after the first dose, only the first dose, they had good antibody response. So even though we are a little bit late, I think the second dose is due, probably they will get within next 1 to 2 weeks. So it won't be a bad situation. It would be okay, because we know the more the gap between the first and second dose, when it is researched and confirmed, it's better the immune response. So what I would like to say, those who are awaiting the second dose, they need not have an additional heartache that it got delayed.
Are vaccines effective, asks a viewer, who says that Dr. Rajendran Kapila, an epidemiologist from New Jersey, took both shots of the Pfizer vaccine and then visited Delhi to visit his father-in-law who was ailing. Dr. Rajendra got COVID and unfortunately passed away. Pfizer is regarded as the top vaccine, but still didn't save him. Are vaccines effective?
Definitely, vaccines are effective. Now, this issue is rotating around the deaths. Now, if we look at the deaths happening in our country as well as in other countries, in our countries, almost 75 to 80% of the deaths occurring, they have additional risk factors or comorbidities like diabetes, hypertension or heart disease or other immune diseases, something like that. So probably I would like to know if Dr. Rajendran had any other comorbidities as well where they are vulnerable, because this is about the immunity of your body, how well you face the infection. So when you have other comorbidities in your body, your body's ability, your body's sharpness of the immune system is compromised. This is the other side of the story. This is why the disease is not that prevalent among the kids, young kids, because they have a very good, very prompt immune system. So the chances them catching and chances them progressing into severe disease is very minimal. You may recall that recently there was a news item saying 10 kids died in Lady Ridgeway Hospital. So these 10 deaths were reported over more than 1 year's duration. It was spread, not really, it happened at once. So over and out of those 10 deaths also, most of the kids, they have other comorbidities like congenital illnesses or some other comorbid conditions. Of course, there was one child, I was told by the professor today morning, that they were very late to come to the hospital. So these two things are contributing to the deaths. One is the comorbidities, and the number two is getting late to seek medical supplies.
You must get there. All right. Thank you for the questions. It's now time for a little break in which we will find out what the headlines are in store for us this evening on the Primetime News. But I'm 75 plus, and my wife and I have received the Astra first dose, and the second dose was supposed to be in June. When will we get the second dose? Let's get an answer after this short break.
Newsfirst Newsline with Faraz Shaukatali.
Army commander says no decision to impose restrictions during long weekend. Weddings to be prohibited if relaxed restrictions are misused. Frontline Socialist Party to enter discussions for a political chain.
බලාපොරොත්තු වෙනවා ජනතා විමුක්ති පෙරමුණත් එක්ක දෙමළ ජාතික සන්ධානය එක්ක ශ්‍රී ලංකා නිදහස් පක්ෂය සමසමාජ පක්ෂය කමියුනිස්ට් පක්ෂයත් එක්ක මේ ඉදිරි දින කිහිපය ඇතුළේ අපි ඔවුන් සමග සාකච්ඡා කරන්න බලාපොරොත්තු වෙනවා.
Opposition leader says people will decide on MPs who voted against the no confidence motion.
ඊයේ දවසේ 3-2කින් පාර්ලිමේන්තුවේ മന്ത്രിවරු කියා සිටියා තෙල් මිල ඉහළ දමන එක හොඳයි කියලා. ඒ ඔක්කොම ආණ්ඩු පක්ෂේ.
Colombians protest against president's new tax policy.
Newsfirst Newsline with Faraz Shaukatali.
And welcome back to Newsline Live. I'm in conversation with Dr. Ranjith Batuwanthudawa from the Health Promotion Bureau, where he is a director. Very good evening and back to the program. Welcome back. So what is that answer? I am 75 plus and my wife and I have received part 1 of the dose. The second one's due in June. It's now July. What can they do?
So Sri Lanka, we are receiving AstraZeneca second, another consignment very near future, within 1 week, 2 weeks. The moment it arrives here in the country, it will be provided to the people who are awaiting the second dose. So most of them are in the Western Province and Colombo district. So if they have provided the mobile number when they got the first dose, they will receive an SMS indicating where and when to come for the vaccination. If they have provided a fixed number, they will get a telephone call. If not, the places and the times will be announced through media, social media, and by the MOH they will send loudspeakers announcing giving the vaccination.
What about this mix and match business?
This I personally believe that it's again the terminology. It's not mix and match like. It should be the people who got the first dose of a different vaccine getting the second dose of a different make.
Yeah.
So this is happening in the other parts of the world as well, and in some countries their regulator is advising to do that. For example, the people who got the first dose from AstraZeneca, it seems they are getting a better immune response when they get the second dose from Pfizer or Moderna, because we know those are the two types of varieties of vaccines. And if you consider the immunity in our body, there's a component of the immunity system which is called memory immunity. In fact, we have a cell called memory B cell, that is a specific type of white blood cell. So they keep the memory inside the body going on. So this memory immune system, memory B cell mediated immunity, is very high when you have these two varieties vaccines given. It boosts the memory of the immune system. So having the two doses from two different, but is researched and published is AstraZeneca first dose and the Pfizer second dose, that is accepted by the WHO even.
We have a viewer who's saying that they do wish, in essence what they're saying is they do wish that our political leadership here would be more in your face, like the Prime Minister of New Zealand, Ms. Ardern, you know, where she showed how to use the mask and so on. Do you think it'll help if our president comes there and gives a lesson, or will that people will say, oh well, look, he's now militarizing that too?
I think whenever the president comes on the TV, he's always wearing the proper mask properly.
Yes, I know.
I think that's one of the best examples he can give.
Yes, but do you think he should give us all a lesson on how to do that?
I think on behalf of the government, the Ministry of Health is doing the job, and as the Health Promotion Bureau, we are thoroughly engaged with that.
Yes.
And we are making each potential opportunity to drive this message home.
Indeed.
That each one of us should be wearing the mask properly every time when we are out of our house. And even at the house, where if your household is in quarantine, if you have one person who is been quarantined in your house, the other householders should be wearing the mask. So this is one of the most valuable piece of equipment we are having at the moment with the current context of COVID-19, and we should get used to it. We should be using it more often.
So what you're saying is these people who've had the first dose, because several questions about that, by the time they've had the first of the AstraZeneca, they might as well wait to get the second one, or is it okay if they go and sort of mix it with something else?
I think even the WHO is recommending the government's decision-making bodies to make that decision, not the individuals. So even in a country, we have a committee called National Advisory Committee on Communicable Diseases. So they were taking time to make a decision until if we are getting the AstraZeneca on time. So when there was not real absolute confirmation, then only we tried to give a Pfizer dose when we were having the second dose of Pfizer, because even WHO recommended first dose AstraZeneca followed by Pfizer second dose, and we gave a little bit of Pfizer as a second dose in Colombo Municipality Council area, but then we got the confirmation of receipt of AstraZeneca. Then it was decided to go back to first dose AstraZeneca with second dose AstraZeneca.
As director of the Health Promotion Bureau, is there a case for elderly people, and elderly care homes for the vaccination to be carried out there rather than for them to go out?
I think the advice given by the Ministry of Health and the COVID vaccination task force, including the President, was to vaccinate all the elderly homes by visiting the elderly homes themselves. I think all the emergers did that.
So that's a good. Somebody else is talking about when AstraZeneca comes, not only the people within the CMC limits, there are many more from Colombo district who got the first. Will they also get it as soon?
Of course,
how does that work?
there are 600, close to 600 or 650,000 people who got the first dose of AstraZeneca waiting for the second dose. Each and every one of them will get the second dose of AstraZeneca.
Okay, so that's
yes,
irrelevant whether they live in Colombo or whether.
Yes, whoever who got the first dose, they will get the second dose as well.
And as we come towards the end, we've about 5-6 minutes away. What do you advise the public to do? What do you advise the public to do?
Yes. Now, I have a special request to all the institutional heads. I mean, we are, as a society, we are made up of institutions, maybe banks, maybe officers, public officers, private officers. So each and every head of the institution has a major responsibility to tackle this COVID-19 situation in our country. Please make sure that your institute has a policy on COVID control measures, that wearing the mask all the time, wearing the proper mask all the time, and providing hand washing facilities at the entrance to your institute as well as inside your institute. I think this is a responsibility lies with the head of the institute. This is a mandatory thing, irrespective of our vaccine coverage, irrespective of the versions or the new varieties circulating, and to make sure that they are practicing it all the time. And another one important fact I want all these institutes to follow is having the meals together. That has to be completely abandoned until we get over this COVID-19 situation.
May you to come back.
Eating alone is a must,
Right.
because we have noted in the institutes, in the offices, wherever there had been outbreak, the index case has been taking the meals with the others. So that has to, because
We need to
obviously
stop
you
that.
can't be wearing the mask and eat your meal.
Make sure you eat alone.
Yes, that's it.
How serious is the Delta variant situation in Sri Lanka?
I think so far the officially confirmed cases are numbering at 38, but it is circulating in our society because the first cases were detected by random sampling. So it says it is in the community, so it could be serious, because from the experience of other countries we know that it spreads faster and it causes more severe disease.
So we need, but you continue to plug the case for washing your hands, for wearing the mask, and maintaining your distance.
Now we have to say this: washing the hands with use of soap and water. Why soap? Soap will destroy the protein cover of the virus. So if you have touched your hands, when you use the soap, it will destroy the virus. Why the mask? Because this virus gets into our body through our respiratory system, the external, the nose and the mouth. So when you have covered your nose and mouth properly all the time when you are outside your home, then there is no way the virus can enter your system. So wearing the mask, it's a must. Keeping your hands clean, it's a must. Why you should keep the distances? Then even though the other person sneezes or coughs, the chances of that virus with the particles coming into your system is very minimal. So I think irrespective of the variant circulating, even though we never know, we might get an even more serious version than the Delta version in the
So
future.
we need to be careful.
We have to follow the guidelines properly and be safe. Each one of us has a responsibility.
And it's a very serious responsibility.
It's a very serious responsibility.
For all those in the leisure industry, in the entertainment industry and so on, hotels and so on, when do you think, now you told us that it's about 10% of the population's got the double vaccination and so on, or the full dose. When do you think, at what point will the graft, when we reach a certain level, what is that level that will help Sri Lanka to return to tourism and so on?
I think we have to look around the world what is happening, and we can see some of the countries, they have completely vaccinated their community, but still they are getting some cases, more cases and deaths, and still they are open and the tourists are coming. So we have to see what is the best practices available and learn from their experiences and select what is the best option for us. And I strongly believe the government plan is to to get more vaccines, and over the next 3 years, 3 months, it is expected that we would get another 10 to 12 million doses of the vaccines, and with that we should be able to vaccinate overall more than 40% of the total population and about over 60% of the targeted population. And that case, I think we'll be in a better foot to revisit and decide our strategy going forward.
One of our viewers is suggesting that you're excellent at what you're doing, and that you ought to be in politics and become the Minister of Health.
Thank you very much. I'll give my first interview with you when it happens.
Thank you. Well, producer, write it down in the diary. Thank you. There's another one, very quickly, because there's the last bit. Why are nightclubs allowed to operate? Because they're saying that you can't control the people, there's they're very close contact and so on. So how come nightclubs are allowed?
I think irrespective of whether it's a nightclub or the religious place, the guideline is the number and the distancing. If you check on the guideline, it's clearly stated to mark the seating, mark the floors and keep the distance. So as long as those guidelines are adhered, I think it's the number of people which matters.
Dr. Ranjith Batuwanthudawa, thank you very much. It's been excellent talking to you. Thank you very much. Thank you. And that's the way it was on Newsline Live. It's now time, of course, for that wonderful program that we all wait for the whole evening, which is the primetime news from News First. Take care, great evening ahead, and God bless you.